So I'm going to explain how to do venipuncture on a fake arm and how to figure out which one's the vein and which one's not the vein. So start off by having everything ready. Make sure you have the tubes that you need. The gauze to prevent the bleeding, tourniquets, and the tape to put on the gauze. You wash your hands and then you get some gloves. Make sure you're not wearing any jewelry. And the way to feel for the vein is you feel for a very firm, thick tube-like, and it bounces when you press on it. You can sometimes see it. This is the little vacutainer, the needle. The tourniquet is to make the vein pop out even more. You lift the patient's arm. And you tighten it a little bit, not too much, or else it's gonna cut circulation and it will hurt the patient. You make a little bowl like this and you put it under. And make sure when you do it, it's on the other way around. Or like this is fine. And before you start, make sure you always clean the area. In every clinic, you usually get the alcohol pad. But since I don't have any alcohol pads with me, I will use this instead. Wipe the area you're about to puncture. Vacutainer. Don't push on this part because there's a needle here. Screw it on there. Pull this out. You got the vein. Get the tube you're about to use. Make sure that you pull on the skin down a little bit before you puncture. And swiftly like this. And then push the tube in. And blood should be able to go through. Before you're done, you grab your gauze, a clean one, a new one. You pull on the tourniquet, take it off, take out the tube, put the new clean gauze on there, pull out this, ask the patient to hold it, and they'll hold it. Be careful, cap it. Grab this again, grab the tape, put it on the patient so that way they don't continue bleeding as they leave the clinic. Another easy thing would be to always have these in handy. They always have it in every clinic. You don't have to take out the needle, but since this is small, throw it in the little sharps container and keep it there, and then that's how you draw the blood. What I meant is that usually every clinic has this. They usually have a bigger version of this sharps container hanging on the wall or right next to the phlebotomist. But since this one is smaller, it's not going to fit the whole thing in. So for this purpose, I just remove the needle and throw it in. And this is the part that I said not to touch, mostly because when it's retracted, there's a needle right there. And that's what punctures the tube when you insert it into this container. And this is the butterfly needle. It's preferably used for older patients or patients that have veins that roll or smaller veins. It makes it easier to access the vein. This is usually what the needle looks like. This is just like the other needle I showed you. This one, this gray tip, also contains a needle. So you have to be careful with that. The wings are so it stays steady when you insert it into the patient.